Hi, it's great to be here today. I will be talking about finding joy in work, lessons from high performing teams, and my name is Dr. Heather Gilmartin. I have no conflicts of interest, and I do have some funding to acknowledge for this work. Okay, today I will be talking about one aspect of my Veterans Health Administration research program, which is investigating how to build supportive learning environments in VA cardiac catheterization laboratories. Today, I'm going to talk about how helping teams find joy in work can be a tool to enhance employee well-being. So let's talk about joy. Joy in work in particular is a relatively new topic, for the social emotional needs of workers has historically been a low priority. But things have begun to change. Efforts by the Institute for Healthcare Improvement and other organizations have brought joy to the table as an option to address the crisis levels of burnout and turnover in healthcare and in other fields. So, how do you define joy? So, joy has been defined as the feeling of being highly pleased or delighted, which is such a great word. Joy is all about being in the moment, and it makes us feel good. And this is different than happiness, which is defined as the state of pleasurable contentment of the mind. Happiness can sometimes feel like a far-off, distant end state, hard to achieve and to hold. So why are joy and happiness so elusive for adults? Right? I mean, for kids, you give them an ice cream cone, right? And they go mental. But for adults, an ice cream cone, right, is a sugar-filled dairy nightmare that we're going to regret for days. Okay, so the Dalai Lama has been quoted as saying that everyone seeks happiness, joyfulness, but from the outside, from money, from power, from big car, from big house. Most people never pay much attention to the ultimate source of a happy life, which is inside, not outside. So his statement highlights that joy is something we shouldn't try to buy. Joy is something we can create for ourselves and for those around us. This is hard to do in a culture that does not make people feel good about themselves, and we're being told to shop until we feel better. What we know is that joy is vital to our well-being, to our cognitive functioning, and performance at work and in life. The U.S. Surgeon General published a report in 2022 that provides guidance on how to enhance healthcare worker well-being. And there was one recommendation that spoke to me and to my research. And it was the point that we must shift burnout from a me problem to a we problem. In my research with high-performing clinical teams, I saw that some teams did just that. Burnout was a team issue, not an individual problem. When anyone on the team reported they were creeping towards burnout, the team talked about joyful moments, about prioritizing connection, and they expressed gratitude routinely. So many teams have adopted the Institute for Healthcare Improvement's Joy Framework. But they were struggling to find joyful moments, for they were looking for those times when you get a flush of emotion, right? Associated with winning a game or an award or saving a life, right? They then started to look smaller, look for the glimmer moments, and they found them everywhere. Deb Dana, a licensed social worker, coined the term glimmers in her 2018 book. She describes glimmers as micro moments of joy that begin to shape our system in very gentle ways. A shared laugh between cases, a visit by the pet therapy dog, a really good parking spot. Deb Dana notes that these moments, when acknowledged, prime the nervous system to relax and feel the world is okay, even for a fleeting moment. Managers shared that they started asking their team for glimmer moments, and it became a buzzword that brought attention to the moments of joy all around them. So the importance of building connection on well-being was reported from the Harvard Study of Adult Development, which started in 1938. This longitudinal study was launched to reveal the clues to leading healthy and happy lives, and now includes the offspring of those original Harvard students and has expanded to inner city residents of Boston as well. The researchers report that the surprising finding is that our relationships and how happy we are in our relationships has a powerful influence on our health. So Dr. Robert Waldinger, the current director of the study, went on to say that taking care of your body is important, but tending to your relationships is a form of self-care too. The study revealed that close relationships, more than money or fame, are what keep people happy throughout their lives. Relationships that make you happy can and should happen at work. For we spend, on average, 90,000 hours at work over a lifetime. So how did the high-performing teams I spoke to build connection? The manager intentionally built time in the workday for people to get to know each other as humans, not just as their professional role. This looked like a manager who started a meeting or huddle with icebreaker questions to get people talking and sharing. The goal of the questions are to help teams get to know each other, to build trust and mutual respect. They do this with in-person and virtual meetings and reported it only takes a couple minutes, depending on the size of the group. The questions can be random, like the ones I've listed on the slide, and you can search for more on the internet. The key piece, though, the guidance that managers gave me was that the leader should always share first, then pass the question to someone else. Some people may not want to engage or just want to get to the first agenda item. But every manager I spoke to said, over time, people started to enjoy it. Not everyone, but most. And teams reported the practice lightened the mood and helped people to see each other differently. And then how did teams incorporate gratitude into their work? One team shared that part of their end of the day debrief included a gratitude moment where anyone on the team could say thank you to someone else. And this started on its own. Someone gave a shout out to a colleague who shared their sandwich, for he had no time for lunch, which seemed like such a small thing, but meant so much to that person and got them through a chaotic day. Organically, people started doing gratitude shout outs, so the clinical manager added it to the debrief checklist to ensure they would always make time for it, but also to make sure that if the leader wasn't there that day or there was turnover, that it would be something that was systematically implemented with high reliability. So this spread to other teams because it wasn't an organizational initiative or required sending an email, right, or writing a thank you note. It was personal, it was authentic, and it was their own idea. Interestingly, their practice is grounded in science. The Gratitude 1-2-3 practice outlines that expressing gratitude should be specific, acknowledge a person's thoughtfulness, and how the action benefited others. By including on the checklist, this became a we practice, right? Not just a me practice, which can change the culture of a team. So in summary, if you're looking to enhance worker well-being in your setting, create an environment and systems to identify and share glimmer moments, build connection, and express gratitude. Finding joy is much more fun when it is part of the way a team works, and it does not require individual effort. If it is part of the system, it will survive chaotic days, staffing changes, and become part of the team culture. So thank you very much. I hope this brought you a glimmer moment in your day. And if you have questions or want to learn more, please reach out to me. Also, the references that I mentioned in the presentation can all be looked at here. And lastly, this talk was taken from a paper that I wrote with a colleague, Dr. Sanjay Saint, in the New England Journal of Medicine's Catalyst, titled Finding Joy in Medicine, a Remedy for Challenging Times. And that is something that you can access for free, and I encourage you to have a look. Thank you so much, and I wish you joy.